When I discovered how pharmaceutical companies have completed their economic takeover of America, I was horrified. This isn't just about drug prices. This is about the systematic capture of the entire American economy through healthcare control. I'm Megyn Kelly. For 20 years, I've covered corporate power, government regulation, and economic policy. But nothing prepared me for the documents showing how Big Pharma has executed the most successful economic coup in American history. The pharmaceutical industry doesn't just sell drugs anymore. They control healthcare policy, insurance systems, government spending, and medical education. They've created a system where Americans must pay whatever they demand or die. And most people have no idea how completely they've been captured by this medical economic cartel. You think drug companies compete with each other to offer lower prices? You think government regulations protect consumers from pharmaceutical exploitation? You think insurance companies negotiate fair prices for medications? The reality is that Big Pharma has eliminated competition, captured regulators, and turned insurance companies into collection agents for their price manipulation schemes. Your health isn't in your hands anymore. It's in their hands. And they're using it to extract unlimited wealth from American families. Let me be clear about my sources on this devastating story. During my Fox News tenure, I regularly covered healthcare policy and interviewed pharmaceutical executives, FDA officials, and insurance company leaders. I thought I understood how the industry operated, but the most revealing conversations happened off the record. In 2018, I spoke with a former Pfizer executive who had become concerned about industry practices after retirement. Megyn, he told me during a private dinner, we stopped being a pharmaceutical company years ago. We're a wealth extraction company that happens to sell drugs. The business model is economic control, not medical care. I thought he was exaggerating about profit motives. I now realize he was describing systematic strategy. When I moved to NBC, I had access to Department of Health and Human Services studies about pharmaceutical pricing and market concentration. Federal economists have been tracking industry consolidation and its economic impact. Their internal assessments show an industry that has achieved unprecedented control over American economic life. Now that I'm independent at MK Media, I can reveal what those classified reports actually demonstrate. The pharmaceutical industry has completed its transformation from medical service provider to economic overlord, and they're using that power to bankrupt American families while enriching themselves beyond measure. The scale of pharmaceutical control exceeds anything in American economic history. 5 companies control 85% of the global pharmaceutical market. Pfizer, Johnson & Johnson, Roche, Novartis, and Merck essentially determine which medications are developed, how they're priced, and who can access them. But market concentration is just the beginning. These companies have achieved something far more valuable than monopoly power. They've achieved control over human survival itself. Unlike other industries, pharmaceuticals face inelastic demand. When people need medications to live, they'll pay any price. The industry has exploited this reality to create the most profitable business model in history. Insulin costs $3 to manufacture and sells for $300. Epinephrine costs $1 to produce and sells for $600. Cancer drugs that cost $50 to make sell for $10,000 per dose. These aren't market-driven prices. These are extortion prices set by companies that know customers have no choice but to pay. The American Diabetes Association estimates that diabetics now spend an average of $18,000 annually on medications and supplies for a condition that was manageable for $500 annually 20 years ago. The American Cancer Society reports that cancer patients face an average of $150,000 in annual treatment costs. Families sell homes, exhaust savings, and declare bankruptcy to pay for medications that cost pennies to produce. This isn't happening because drug development is expensive. This is happening because pharmaceutical companies have eliminated every constraint on their pricing power. The pricing strategy is called value-based pricing. Instead of pricing drugs based on production costs plus reasonable profits, companies price drugs based on the value of human life. If a cancer drug extends life by 6 months, pharmaceutical companies claim they can charge $200,000 because 6 months of life is worth $200,000 to patients. If a diabetes medication prevents complications, companies claim they can charge $20,000 annually because preventing complications saves money on hospital stays. This pricing philosophy treats human life as an unlimited revenue source. The more desperately someone needs a medication, the higher the price they can charge. And they've restructured the entire healthcare system to support this extraction model. Pharmaceutical companies now own pharmacy benefit managers, insurance companies, medical research institutions, and physician networks. They control every step of the healthcare process. When your doctor prescribes a medication, they're often prescribing from a formulary controlled by pharmaceutical companies. When your insurance covers the prescription, the insurance company is often owned by the pharmaceutical company. When you fill the prescription, the pharmacy benefit manager is often owned by the pharmaceutical company. You think you're participating in a competitive healthcare market. You're actually participating in a vertically integrated extraction system designed to maximize pharmaceutical profits. CVS Health owns CVS Pharmacies, Aetna Insurance, and Caremark Pharmacy Benefits. This allows them to control prescription decisions, insurance coverage, and retail pricing simultaneously. Express Scripts, owned by Cigna, controls pharmacy benefits for 85 million Americans. They determine which drugs are covered, which pharmacies you can use, and how much you pay. United Health owns Optum Rx Pharmacy Benefits and Optum Physician Networks. They control both the doctors who prescribe drugs and the systems that determine drug costs. This vertical integration eliminates competition and creates coordinated pricing power across the entire healthcare system. But pharmaceutical control extends far beyond healthcare into government policy. The industry spends more on lobbying than any other sector. $4.7 billion annually on direct lobbying, plus unlimited educational spending that influences policy without reporting requirements. Pharmaceutical companies employ more former government officials than any other industry. FDA officials regularly move to pharmaceutical companies after approving drugs. Congressional staff members become pharmaceutical lobbyists after writing healthcare legislation. The revolving door ensures that government healthcare policy serves pharmaceutical interests rather than public health. The FDA approval process has been completely captured by industry influence. Pharmaceutical companies pay user fees that fund FDA drug reviews. The agency that's supposed to regulate drug companies is financially dependent on them. FDA advisory committees include pharmaceutical consultants, researchers funded by drug companies, and officials with financial stakes in approval decisions. Medicare and Medicaid formulary decisions are influenced by pharmaceutical lobbying and campaign contributions. Government healthcare programs are required to cover expensive brand-name drugs, while generic alternatives are delayed or blocked. The result is a system where taxpayers fund pharmaceutical profits through government healthcare programs. Medicare Part D, the prescription drug benefit, has become a wealth transfer system from taxpayers to pharmaceutical companies. Instead of negotiating lower prices, Medicare is prohibited from using its buying power to reduce costs. Medicaid expansion has created millions of new customers for pharmaceutical companies, while taxpayers pay the bills. The Affordable Care Act requires insurance coverage for prescription drugs, but includes no meaningful price controls. This created guaranteed customers for pharmaceutical companies without constraining their pricing power. Every major healthcare policy initiative for the past 20 years has increased pharmaceutical profits while increasing costs for patients and taxpayers. But perhaps the most sophisticated aspect of pharmaceutical control is the manipulation of medical research and education. Pharmaceutical companies fund medical schools, medical journals, medical conferences, and medical research. They control the information that doctors receive about drug effectiveness and safety. Medical schools receive hundreds of millions in pharmaceutical funding. This funding influences curriculum, research priorities, and faculty hiring decisions. Medical journals depend on pharmaceutical advertising and sponsored research. This creates editorial bias toward positive coverage of pharmaceutical products. Medical conferences are funded by pharmaceutical sponsorships. Continuing education requirements for physicians are often met through pharmaceutical-sponsored programs. The result is a medical profession that has been systematically educated to prescribe expensive pharmaceutical solutions rather than explore alternative treatments or preventive care. Physicians prescribe medications they believe are the best available treatments, but their information about treatment options comes from sources controlled by pharmaceutical companies. Medical research has been corrupted by pharmaceutical funding and influence. Clinical trials are designed to show positive results for pharmaceutical products. Negative results are suppressed or minimized. The opioid crisis provides a perfect example of how this system operates. Pharmaceutical companies funded research claiming that opioids were safe and effective for chronic pain. They influenced medical education to encourage opioid prescribing. They lobbied for policies that increased opioid access. The result was 500,000 deaths from opioid overdoses and millions of addicted Americans. But pharmaceutical companies made hundreds of billions in profits before the crisis became undeniable, and they faced minimal consequences for their role in creating the crisis. Purdue Pharma declared bankruptcy, but the Sackler family kept most of their wealth. Other opioid manufacturers paid fines that were small fractions of their profits. The regulatory system designed to prevent pharmaceutical misconduct instead enables and protects it. The economic impact of pharmaceutical control extends far beyond healthcare costs to the entire American economy. Medical expenses are now the leading cause of personal bankruptcy in America. 66% of bankruptcies involve medical costs, and 78% of medical bankruptcies involve people who had health insurance. Having insurance doesn't protect families from pharmaceutical price manipulation because insurance companies pass costs through to consumers via higher premiums, deductibles, and copays. American families spend 18% of income on health care compared to 9% in other developed countries. The difference is almost entirely pharmaceutical pricing. Employer health care costs have increased 500% since 1990, mostly due to pharmaceutical expenses. This forces employers to reduce wages, eliminate benefits, or avoid hiring. Government health care spending consumes 28% of the federal budget and 32% of state budgets on average. These costs are projected to increase 6% annually, primarily due to pharmaceutical price inflation. The economic burden of pharmaceutical pricing is destroying American competitiveness. Companies can't afford to hire workers with health care benefits. Families can't afford to start businesses because they need employer health care coverage. Innovation suffers because pharmaceutical companies focus on manipulating prices for existing drugs rather than developing new treatments. The pharmaceutical industry spends more on marketing and lobbying than on research and development. They've optimized for wealth extraction rather than medical advancement. Most breakthrough medical research actually occurs at government-funded universities and research institutes. Pharmaceutical companies acquire promising research and development through licensing deals and acquisitions. They privatize the profits from publicly funded medical research while charging taxpayers maximum prices for the resulting medications. What can Americans do to protect themselves from pharmaceutical economic control? First, understand that this system is designed to extract maximum wealth from medical necessity. Every interaction with the healthcare system involves financial manipulation. Second, explore alternatives to the pharmaceutical-controlled healthcare system. Direct primary care, medical tourism, compounding pharmacies, and international prescription sources. Third, support political candidates who oppose pharmaceutical influence and support price negotiation, importation, and generic competition. Fourth, demand transparency in pharmaceutical pricing, research, and regulatory relationships. The industry's power depends on obscuring its practices from public scrutiny. Fifth, build health and wellness practices that reduce dependence on pharmaceutical interventions. Prevention and lifestyle medicine can reduce vulnerability to pharmaceutical price manipulation. Sixth, create mutual aid networks and community health resources that provide alternatives to pharmaceutical-controlled healthcare delivery. But individual action alone cannot counter systematic pharmaceutical control over American economic life. This requires political movement to break pharmaceutical power and restore competitive markets in healthcare. Medicare should negotiate prescription drug prices. Patent laws should be reformed to prevent evergreening and market manipulation. Generic competition should be accelerated through regulatory reform. Pharmaceutical lobbying should be restricted. Revolving door employment should be prohibited. Clinical research should be conducted by independent institutions without industry funding. Medical education should be freed from pharmaceutical influence. Continuing education requirements should be met through public institutions rather than industry-sponsored programs. But political reform requires overcoming the most powerful lobbying force in American politics. Pharmaceutical companies have unlimited resources to prevent changes that threaten their control. They've captured not just regulatory agencies, but entire political parties through campaign contributions, lobbying expenditures, and revolving door employment. Breaking pharmaceutical power will require sustained political pressure that exceeds industry influence. This means organized movements that can match pharmaceutical resources and organization. Labor unions, patient advocacy groups, and small business organizations all have interests in reducing pharmaceutical costs. Coalition building across these groups could create political force sufficient to challenge industry power. But such coalitions require understanding the scope of pharmaceutical control and the systematic nature of their wealth extraction strategy. I'm revealing this information not to discourage people from necessary medical care, but to expose the economic manipulation that has made medical care unaffordable. Understanding pharmaceutical control strategies enables more informed decisions about healthcare spending and political action. The choices between accepting unlimited pharmaceutical wealth extraction or building political power sufficient to restore competitive markets and reasonable pricing. But that choice requires recognizing that pharmaceutical companies have moved beyond providing medical care to exercising economic control over American families and government policy. I'm Megyn Kelly. I've spent my career exposing the gap between corporate propaganda and economic reality. The pharmaceutical industry's capture of American healthcare represents the most successful corporate takeover in modern history. More complete than oil company influence over energy policy, more systematic than defense contractor influence over military spending, more economically devastating than financial industry influence over banking regulation. Because pharmaceutical control exploits human survival, needs to extract unlimited wealth while preventing political resistance through regulatory capture and information manipulation. Your health has become their wealth extraction mechanism. Your medical needs have become their economic leverage. Your family's survival has become their profit opportunity. The system is designed to make you pay whatever they demand or face death, disability, or suffering. And it's designed to prevent you from understanding how completely you've been captured. Breaking free requires understanding the system, supporting alternatives, and building political power sufficient to challenge pharmaceutical economic control. Whether American families remain trapped in this extraction system or build power to escape it depends on recognizing what's actually happening versus what the industry wants people to believe is happening. The choice is yours, but the pharmaceutical industry is counting on you not realizing you have a choice. This has been Megyn Kelly. And remember, in a world of medical economic manipulation, understanding the system is your most valuable medicine. They can control your healthcare options. They can't control your political choices. Whether you use your political power while you still have it determines whether your health serves your family or their wealth.